Our caring physicians and health workers, and all citizens of the Commonwealth, I am Dr Osahon Enabulele, the President of the Commonwealth Medical Association, the umbrella organization for all national medical associations and physicians in the 54 countries of the Commonwealth of Nations. My team and I bring you warm fraternal greetings on behalf of the association as we contend with the global challenge of COVID-19. Like many times in history, humanity is again being challenged by a fast-spreading and evolving disease called COVID-19. In recent history, the world was similarly confronted, and indeed it defeated several diseases, including swine flu, bird flu, SARS, Marburg, and Ebola. The world is about to also totally eliminate others like polio. Coming in this second decade of the 21st century, coronavirus disease, COVID-19, has posed a great challenge to our global interconnectedness and the surge of human industry. Indeed, it has challenged our way of life, our health, our well-being, and our prosperity. It has also attenuated the straight divide that existed between ideological blocs and advocates of big or small governments that have polarized the world for centuries, as governments are increasingly compelled to assemble palliatives to save their population from permanent health, social, and economic ruin. As at the end of March 2020, over 40 Commonwealth member nations have had confirmed cases of COVID-19. It is our earnest prayers that this does not affect more countries. Tragically, many of our physicians, many of our health workers, and indeed many of our citizens have died. May their great souls rest in perfect peace. Many also lie stricken, and the CMA wishes them excellent and speedy recovery. Yet, it may get worse before it gets better, particularly if we do nothing to strengthen and amplify all-inclusive and strategic interventions in accordance with scientific and professional advice. Our esteemed physicians and health workers in the Commonwealth, how are you coping at this time of the great global challenge caused by the COVID-19 pandemic? How are you coping in the face of obvious resource challenges and inadequacies? I want to assure you that the Commonwealth Medical Association deeply appreciates your immense sacrifices, your sustained commitment to duty and provision of quality care despite these resource challenges and inadequacies, including inadequate personal protective equipment, the PPEs, and incentives for health workers. The Commonwealth Medical Association conducted site visitations to some hotspots and is truly proud to have found that our members, in teams and partnerships with other health workers, from village clinics and district hospitals to tertiary hospitals, are demonstrating exemplary commitment to fighting this health war. We also appreciate the efforts of national medical associations, the World Health Organization, the Commonwealth Secretariat, and indeed the Commonwealth Secretary General, Right Honorable Patricia Scotland QC, and the governments of the various countries in strongly confronting this crippling global health challenge. The daunting challenges notwithstanding, the progress so far made, particularly in China, evidently demonstrates that COVID-19 can be defeated if there is sustained, strong political will and commitment, backed with strong health institutional frameworks, adequate protection and incentivization of health workers, citizen participation, and strict adherence to defined promotive, preventive, and clinical care protocols. We therefore call on national medical associations in the Commonwealth to continue to adopt proactive, progressive, dynamic, and pragmatic strategic approaches, and to sustain their efforts and partnerships with governments, the private sector, and other stakeholders to bring an end to this pandemic. We also call on governments to urgently improve on their political will and commitments, and to deploy adequate and appropriate resources, including personal protective equipment and incentives for physicians and other health workers, to ensure that we all, in a most motivated way, confront and combat this global pandemic. Indeed, everybody is called upon to see this as a patriotic duty, with heightening of positive orientation, the level of awareness and participation in the efforts to defeat the virus. The CMA is convinced that this global commitment must remain a one-for-all and all-for-one fight against COVID-19. The CMA reaffirms its commitment to fight along with the World Health Organization, the Commonwealth Secretariat, governments, the private sector, and indeed the global community, to check the escalation of the virus and bring back those on the brink through effective treatment, care, and support, as well as the deployment of our resources, including the Commonwealth Medical Association Online University, the CMA e-Varsity. For our citizens, we urge you to always seek credible information and to ensure you strictly adhere to the public health preventive measures and advice issued by the World Health Organization, your country's health authorities, your physician or healthcare provider. Maintain a high level of personal hygiene and avoid exposure to the virus. This you can do by properly washing your hands with soap and water for at least 20 seconds, or by using an alcohol hand sanitizer containing at least 60% alcohol. Because the virus can infect an individual if he or she touches a surface or object that is contaminated with the virus, please avoid touching your mouth, your eyes, and your nose with unwashed hands. Clean and disinfect frequently touched surfaces and objects. And ensure that you sneeze or cough with your mouth and nose covered with a tissue paper, and discard the tissue paper into a trash bin, and thereafter wash your hands immediately. Or if you don't have a tissue paper, please sneeze and cough into a flexed or bent elbow. Avoid crowded places and mass gatherings, and maintain a social distance of at least 2 meters or 6 feet or 3 steps from the next person, especially if the person is coughing or sneezing. And if you are ill and coughing or sneezing, or taking care of an ill person with symptoms similar to those of COVID-19, please ensure you put on your protective equipment, including your face mask. And please endeavor to create time for relaxation and stress less. Exercise and eat healthy foods, including fresh fruits and vegetables, and sleep well. Finally, know that COVID-19 is not a death sentence. Indeed, many have survived it. So if you unfortunately get infected, don't be crestfallen, because you too can survive it. So if you suspect you have been exposed, or you have been in contact with someone with COVID-19, or you are ill and having symptoms such as fever, cough, or difficulty with breathing, please immediately call your physician or healthcare provider or the numbers provided by the health authorities. Let's remain globally connected and united in this historic struggle to conquer coronavirus disease, COVID-19. We shall surely overcome. Stay safe.